CMI is a premier outpatient clinic located in the heart of BGC with over 150 specialists and subspecialists on our roster. CMI is always here for you for your medical outpatient needs, such as specialist consultations by phone, video, or in person, diagnostic procedures, and preventive treatments such as vaccinations and executive checkups and annual physical exams. At CMI, there are no crowds, no queues, no hassle. CMI is the safe clinic for you and all those who are dear to you. Hello, everyone. My name is Joseph Romero, CMI President. And thank you for joining us today in Ask the Experts, a dermatological Q&A on hair loss and hair care with our speakers, Dr. Jasmin Jamora, CMI dermatologist, and Dr. Rosario Salud Blas, CMI dermatologist as well. So why a webinar on hair loss at this time? By now, we know that the coronavirus pandemic, or this lockdown, has brought an onslaught of stress, strain, tension, maybe even trauma that manifests itself in different ways. And for some, that manifestation is hair loss. Some medical reports have cited nervousness and anxiety among individuals who see clumps of hair on their pillow when they wake up or in the shower. And they are alarmed by the hair loss that they are seeing. And this is understandable because in general, we consider our hair our crowning glory. And while it sheds naturally due to aging, some of us who are not that of age yet do experience hair loss at a younger age, and this could be due to alopecia or other causes. And today, our doctors, our speaker doctors, will sift through these conditions and let us know which ones are controllable, which ones are treatable. At this time, and as always, CMI wants to make sure that we provide you with medical support by providing you with useful, relevant, and helpful information such as the info we will provide today. At CMI, we're always pursuing our mission of providing you with premier patient experiences. Before that though, let me just give you a few reminders. We have muted everyone's microphones and videos, and we'll continue to do so for the rest of this webinar. For any questions, just type them in the chat box that you see at the bottom of your screen, and we'll try to cover as much ground as we can in this webinar. And please, whenever possible, please provide us with your full name to help us identify you properly for your questions and other concerns. And now, I'd like to introduce our first speaker, Dr. Jasmin Jamora. Dr. Jamora is a practicing dermatologist here at CMI. She was an outstanding medical graduate from the UP College of Med, and she completed dermatology residency at the Skin and Cancer Foundation, Inc., SCFI, and fellowships in immunodermatology at NYU and dermatopathology at Indiana University School of Medicine. She achieved special qualification in dermatopathology from the ICD-EMS section of dermatovenerology. These are big words, Dr. Jamora. And pathology. She's a diplomat and fellow of the PDS, or the Philippine Dermatological Society, and an international fellow at the American Academy of Dermatology. Dr. Jamora is the residency training officer of SCFI Dermatology and also an active faculty member in dermatology and dermatopathology in major hospitals here in the country. She is currently a board director of the Philippine Dermatological Society. Ladies and gentlemen, Dr. Jamora will talk to us about the root cause of our hair loss concerns today. Please welcome Dr. Jamora.
Hello, Jong. Good afternoon. Can you see me?
Yes?
And I will share my screen. Can you see my screen?
Yes, we can. You're good.
Okay, good. So if it's okay with you, I'll just turn off my video while we go through this, okay? So I'm very happy to be here, Jong. It is such a pleasure to be here and to serve our CMI patients. It's really exciting. And I'm super excited to share with you the different causes of hair loss. So we know that hair loss is quite common in adults, and it can have a huge psychological impact. And the effects of hair loss can be devastating. In fact, you know, Jong, I just had a teleconsult from a client, not in Manila, and she was really crying because she said her hair was coming out in clumps. And it is really important for us as certified dermatologists to really reassure the patient and be on the journey with them to try to make sure that we find out what is causing their hair loss. So for some people, it can cause decreased self-esteem and decreased quality of life. And in fact, hair loss can also impact the way other people may perceive us. So it can affect attractiveness, the perception of successfulness, and likability. Let me just explain briefly, Jong, what the hair cycle is for all of our audience members. So just briefly, okay, so all of us could not get haircuts during the quarantine, right? So if we let our hair grow out, so there's about 100 to 150,000 strands of hair on our head. And a majority of them are in this what's called anagen phase, or what we call the growing phase. So if we let our hair grow out, it will take about 3 to 6 years. It'll just keep growing and growing and growing if we don't cut our hairs. So that's called the anagen or growing phase. Now, about 85 to 90% of the hairs on our head are in the growing phase. And then after it reaches the end of the anagen or growing phase, it'll go into this intermediate phase called the catagen phase. So this catagen phase lasts about 3 to 6 weeks, okay? After which it will cycle into the final, it's not really called dying, this is called the resting phase, the telogen hair, okay? Have you guys ever seen your hair fall on the ground and you look at it closely and you see that the tip of it is like a little white bulb? So that's called the club hair or the telogen hair. Now, telogen hairs or the resting hairs will last about 3 months and then it will fall out, okay? So everything that we see falling on the ground in our bathroom, on our pillows, usually are these telogen hairs. So anagen phase, about 85 to 90% of the hairs are in the growing phase. Catagen hairs, about 5 to 10% are in this intermediate phase. And then in the resting phase, I would say about 10 to 15% of our hairs are in this resting or telogen phase, okay? So when you look under the microscope, these growing hairs will be deeply rooted in the fat, okay? This is the healthy anagen bulb. And as it starts cycling down, it will regress, it will move up in the skin, and then it will grow and fall out. But don't worry, because every time a telogen hair falls out, there is a new hair that's pushing it out. There's a new anagen hair that is kind of cycling and pushing it out, okay? So that's why I really want to reassure most people that whatever's falling out, and usually most people will have anywhere from 50 to 150 strands of hair falling out normally per day, okay? So sometimes I'll tell patients, okay, let's count your hair fall every day when you don't shampoo, okay? Because when we shampoo, we expect a little bit more hair to fall out than usual. So how do we know what's causing our hair fall? So your board certified dermatologist will take a very careful history. Okay, what is the duration of your hair loss? What is the pattern of your hair loss? And I'll show you the different patterns later. Is it coming out by the roots, or is the hair breaking at different points of the hair shaft? Is it shedding, or is it just thinning? How old is the patient at the onset? Is the patient taking any medications like anti-epileptics? Is the relationship to their menstruation, pregnancy, or menopause? What is the present or past health history? Is the thyroid gland okay, or do they have some hypo or hyperthyroidism? Is there a family history of hair loss? So this is important for both mothers and fathers. Okay, so we can inherit pattern hair loss from both sides, from both our mothers and fathers. Does the patient have any unusual hair care or hair cosmetics? Are they straightening their hair very often? Are they ironing their hair very often? Are they using some kind of extensions on their hairs? Okay. What is the patient's diet? Are they crash dieting? Are they getting enough nutrition or balanced food? Is the hair coming out by the roots, or is it breaking? Okay, so here are some maneuvers that we do in the clinics to test for hair loss. So one is called the hair card. We simply put a white card near the area where you're losing your hair, and then we can see if the hair is growing out, if we see exclamation mark hairs or broken hairs. So this hair card just provides a good background for us to see what's happening to your hair. The next is a hair pull test. So we will get about 60 strands of your hair at different parts of the scalp, and we will gently pull it from the roots to the end and see how many hairs come out. So if 10% or more of the hairs come out, then that is a positive or an abnormal hair pull test, okay? And finally, the tug test is something that we do to check for breakages along the hair shaft. So we kind of roll the hair between our fingers and see if it's starting to shed or break. The hair mount is where we pull out a few strands of your hair. We put it on a slide and look under the microscope. Trichoscopy is a special LED lit 10x lens device that we use. A lot of your dermatologists at CMI know how to do this dermoscopy or trichoscopy when it's done for the scalp. And we can see very easily if there's breaking of the hair, exclamation mark hairs, and what kind of inflammation is happening at the level of the scalp without doing a hair biopsy. Now, usually our last resort to confirm a diagnosis, if it's a little bit more serious or scarring, is to do a biopsy. So we can take a piece of skin from the scalp and look under the microscope to see if there's inflammation and scarring. This is an example here of alopecia areata, okay? So how do we approach the diagnosis? We can approach it either by looking at hair shedding or hair thinning, but a little bit easier way to make a diagnosis is to first see, is the hair loss focal, or is it just bits and patches of hair? Or is it diffuse? Is it the whole scalp that is shedding? Okay, is it scarring or non-scarring? What about blood tests? Okay, so oftentimes things that can cause hair shedding are iron deficiency anemia, zinc deficiency, biotin deficiency, vitamin D3 deficiency, and your doctor can test for that. Hormones are very, very important, and we can also test for that. Thyroid is extremely important, and we will also test for that. And if you are having a scarring alopecia, and I'll teach you more about that later, we have to rule out things like lupus and lichen planus. Okay, so here are the different tests that your doctor or dermatologist may do just to make sure that you are getting the right diagnosis for your hair loss. Okay, again, these are just some lab studies that we can do. And for diffuse hair loss, let's go through some of the common causes, okay? So one of the most common causes is called telogen effluvium. Have you ever known a lady who gave birth and then about 3 months later, she told you that all her hair was falling out? Okay, so all of us kind of know a lady like that, and it's quite common. So telogen effluvium, remember telogen or the club hairs, is non-scarring, so it doesn't leave permanent damage, and it is also non-inflammatory. It usually happens very suddenly, about 3 months after a triggering event. Now, what is that triggering event? I'll tell you a little bit more about that. And large numbers of hairs can enter the telogen phase. So you know what happens is, remember, usually 85% of the hair is in the growing phase. What happens with telogen effluvium, because of the severe stress, okay? It can be delivery and pregnancy. It can be high stress. It can be dengue fever. You're hospitalized for pneumonia. You had some high thyroid problems. You took some new medications, okay? So this can cause our hair to cycle from 85% anagen or growing hairs into 85% telogen or resting hairs because of the severe stress, okay? And that will cause 85% of our hairs to cycle into telogen, and then 3 months later, you will have a lot of shedding of your hair, okay? So you will have diffusely thinning hair. There are no bald patches, and when we do the hair pull test, it will be positive. What about androgenetic alopecia? So this is what we call nowadays PHL, or pattern hair loss. Why do we call it pattern hair loss? Because it is in a particular pattern. So for men, it is in this M-shaped pattern wherein you have recession of the frontal hairline, okay, in this part of the scalp. And about 50% of men by the age of 50 will have some sort of pattern hair loss. Okay, it's very gradual in its onset. Some people can have it in adolescence or in their 20s with some minimal shedding. Okay, and the hair pull test is usually negative. So what happens here is there is a shortened growing phase due to repeated hair cycles. And then because the part of the scalp that is sensitive to the testosterone is the frontal part of the scalp and the vertex, this is usually what will start to become thin in men. Okay, so actually they're not really bald. If you look closely, you will see tiny, tiny baby hairs. These are the vellus hairs in the androgen sensitive parts of the scalp in men. Okay, so we'll talk a little bit about the treatments later, and I believe Dr. Blas will also talk more about this later. So this is just an algorithm depending on how severe the hair loss is for pattern alopecia in men. So this is what they call the Hamilton-Norwood scale, and your dermatologist or your doctor will put you somewhere along this scale and then start you on therapy accordingly. So the FDA approved topical minoxidil and oral finasteride as treatments. That's FDA approved. And then if it's more severe, hair transplantation and some other treatment options are there. What about for women? So we also call this female pattern hair loss. It is also very common cause for women. And what the pattern is for women is what they call a Christmas tree pattern. So at the top of the scalp, you will see the widening of the hair part. So first a widening, and then it'll form this kind of Christmas tree pattern. Okay, and there are many more causes, not just hormones in women. Okay, let's take a look at this very nice cartoon from Sadik et al. So we can see now that in pattern hair loss, it is not just aging and hormones. There is a lot of microinflammation that is happening, and the hair is very sensitive to environmental and oxidative stress like ultraviolet light, pollution, aging, poor nutrition, psycho-emotional stress, metabolic syndrome, which is diabetes, obesity, dysregulated triglycerides, low vitamin D levels, low iron stores, and of course hormones. So all of these are kind of targets for future therapies in pattern hair loss. We all know that stress really affects the skin and the hair. So in fact, alopecia areata, which we'll talk about later, will be definitely worsened by stress. And we know that psychological stress will even inhibit hair growth. Okay, so stress is a big factor. So for women, what are some treatment options? This is the Ludwig scale for women. It's not the Hamilton-Norwood scale. So depending on where the lady is here, the severity of her hair loss, she can have topical minoxidil, some androgen inhibitors like spironolactone, oral contraceptive pills, depending on what the doctor is recommending. And here is the treatment plan for women with pattern hair loss. Okay, so as of now, for both these types, topical minoxidil is, how does it work? This is an FDA approved medication for hair loss. It prolongs the growing phase of hair growth and increases blood supply to the hair follicle, whereas oral finasteride, which we only recommend for men at this point, is will actually decrease the conversion of testosterone to DHT, which is a more active form that affects the hair. Okay, so both of them will slow the progress of hair loss and stimulate hair regrowth, and it's very, very effective. So we move on to focal causes that are non-scarring for hair loss. So trichotillomania. So have you ever seen a kid pulling their hair until they got bald spots? So this is actually now a DSM-4, or a psychiatric disorder, which is related to anxiety and obsessive compulsive disorder. So it is a repetitive compulsive urge to pull the hair. And you'll see this in usually younger kids. You can also see it in adolescent females and in adults. So you will see these irregular patches of hair loss with broken hairs, and it is usually due to the traumatic stretch of the hair shaft. Another cause for local hair loss, which is inflammatory, is tinea capitis. This is caused by a fungus on the hair. And you will see small patches of hair loss. However, you will see a lot of broken hairs, pustules, a lot of inflammation and scaling, and this needs to be treated with antifungals, okay? So in kids, they tend to be a little bit more exposed to this because of contaminated hats, brushes, and barber instruments. So we have to be a little bit careful. And of course, this is alopecia areata. So commonly, we call this the pocknut, no? So usually most people will not feel it if it's a small patch of alopecia, a well-demarcated patch of hair loss. It is usually abrupt in onset, and your dermatologist will see this exclamation mark hairs. And this is caused by inflammation around the hair bulb, okay? Onset at any age. It may be associated with other autoimmune conditions, and it will yield a positive hair pull test. Now, there are many factors for alopecia areata, okay? Can be genetic, but there's a lot of autoimmune inflammation happening as well here. So you can have the localized one, which can just regrow back on its own, and you can have it very diffuse. This is called alopecia totalis, where the whole scalp has lost its hair, okay? And there are many different approaches to alopecia areata. You must see a dermatologist for this. You can see different parts, and if it's very severe, there are even some immunotherapy that can be applied to regrow the hair, okay? So these are some of the treatment options for that as well. And newer approaches coming down the line are new molecules like JAK inhibitors, biologics. There's even some low-level laser therapy, stem cells, and growth factors, but these need to be further studied. And then finally, we move on to scarring hair loss. I'll just show it to you. We're not going to discuss it very carefully. How do we know that something is scarring? We do not see the opening of the hair follicle anymore, okay? When we look closely at the scalp, you don't see the opening of the hair follicle, which means to say it is permanently scarred. These are usually serious conditions, and we need to see a doctor for these and get a proper workup. So lichen planopilaris is the most common cause of scarring alopecia, usually in middle-aged women. And you have these multifocal patches which are scarring and irregular patches of hair loss. Frontal fibrosing alopecia is becoming more common nowadays. Usually we see this in Caucasian menopausal women, and it is also a scarring alopecia, a variant of lichen planopilaris, and they call it the clown hair. You see how it recedes at the frontal hair here? And some people might mistake it as androgenetic alopecia, but this is a scarring alopecia. And they also tend to lose their eyebrows at the lateral side. So this is also another serious condition that needs to be worked up properly. And finally, discoid lupus erythematosus. This is a variant of lupus. You guys all know that is a serious autoimmune condition. And this will cause a lot of scarring, alopecia here, a lot of inflammation, redness, and scaling. And again, patients with lupus need to be worked up to make sure that they don't have systemic lupus erythematosus. So I want to thank you very much for giving me the time to share with you some common causes of hair loss. Thank you so much.
Thank you, Doc Hamora. Um, I had to stop myself from touching my hair every time you showed the slide of every time you showed photos in your presentation. And you really did get to the root cause of our hair loss concerns. And we'll get to the Q&A portion in a bit. But for now, to complete our presentation, I'd like to introduce our next speaker. Our next speaker is Dr. Rosario Salud Abaya Blas, or we fondly call her Doc Cherry here in CMI. She is one of our active dermatology consultants, and she sits on CMI's medical advisory board. Um, Doc Cherry is a board certified diplomat and fellow of the Philippine Dermatological Society, or PDS, as I mentioned. Doc Cherry is an international fellow of the American Academy of Dermatology and a member of the Asian Dermatological Society. Doc Cherry will talk to us about some groundbreaking and even exciting developments in this area of hair loss and hair treatment. Ladies and gentlemen, please welcome Dr. Cherry Blas.
Hello, can you see my slides?
We can, Doc.
All right. Hang on a bit.
There you go.
There, yay. Hello, thank you to CMI officers, Dr. Hazel Swellig, Dr. Krista Rubio, and Mr. John Romero for today's invitation to speak. And to all the participants on this webinar, welcome. Hair problems are very common. In fact, 80% of Caucasian males, 40% of Caucasian females will eventually have some sort of hair problem by the time they're 70. For Asians, thank God, it's much less. It's about 1/3. And for Black persons, it's even lower. Now, when the dermatology practice reopened after the lockdown, I was surprised to find out that there were 50%, 1 in 2 patients that came to the clinic or called was consulting for aesthetic reasons, namely acne and hair fall. Now, I would like to concentrate today, this afternoon, basically on hair fall and what, as a dermatologic surgeon, what we can do to help our patients. In a nutshell, we can do autologous micrografting techniques. We all know about stem cells. We've heard about it. Stem cells are pluripotent. Stem cells can be anything that the body needs, and they can do this indefinitely. However, what might not be so familiar are progenitor cells. Progenitor cells are basically the early descendants of stem cells. They're children, if you must, but these early descendants are already programmed to form something definitive. So, for example, we get the progenitor cells from the side population, let's say, of the skin. They have no choice but to become skin. If we get them from bone, they have no choice but to become bone. So they're basically oligopotent instead of pluripotent, and they don't do this indefinitely. There is a time limit for them to do this. Now, micrografting. Micrografting means to say we just get a small sample of skin or scalp, in this case, and 1 ml of that could give us about 70 to 80,000 micrographs. The micrographs are composed of viable cells and stem cell markers, growth factors such as CD73, which is important for the formation of keratin, the strengthening of keratin. We also have CD105 with vascular endothelial growth factors, which are important for the blood supply of the scalp. We also have PDGF, PGE2, for example, and they work to promote anagen, as what Dr. Jamora said a while ago. All of these factors, all of these extracellular matrix proteins, all of these stem cell markers, they all work to make sure that the biomolecular pathway, the WNT biomolecular pathway, works perfectly. This pathway is in charge of the communication between cells, for example, as we are focusing now on cells in the scalp. Now, what does CMI have? CMI has one form of autologous micrografting technology called Regenera. What do? We just get a small sample of skin from the scalp, from the back of the scalp, and we harvest just the progenitor cells from the side population. And this is just a small 2.5 millimeter sample. We usually get about 3. And what's important is that both the donor and the recipient are the same. So you have no problem with rejection or with severe reactions. And there are absolutely no chemicals used. We only use normal saline solution. Basically, what the device does is that it cuts the cells, leaving viable cell tissue as well as the cell markers that we need. From 1 ml, we can get about 80,000 micrographs. And in one session, we normally get about 5 to 6 ml. And this is done in one session, outpatient, and this technique is approved both in the US and the Philippines, in Europe, Singapore, and in other countries. Now, I want to focus on the androgenetic alopecia patient. We heard from Dr. Jamora that the history of the present illness is important. In fact, I often tell my patients that the initial consultation will be far longer than the procedure itself, because we have to really dig up into the history of the patient's illness, the past medical history, wherein we find out whether or not the patient has iron deficiency anemia, has PCOS or other problems, and we do the physical exam. I'd like you to focus on the Norwood and Ludwig scale. Dr. Jamora showed this a while ago. The Ludwig scale is for the females. And normally when I look at the patient and the female patient falls between Ludwig scale 1 and 2, they're good candidates for the procedure. For males, it would be the Norwood scale between 1 to 3. Now, we also look more closely at the scalp. Dr. Romero mentioned a while ago doing a dermoscopic exam or trichoscopy, and basically I want to see that there are no signs of scarring. I basically want to see that there are single follicular units, because normal hair from one follicle opening normally will grow 3. There will be one primary hair follicle and secondary hair follicles around the area. So normally a sign of androgenetic alopecia would be 1:1 versus the usual 3 per hair follicle. Yellow dots are a sign of keratin plugs. They may or may not be helpful to me, but what is most helpful to me is this: hair diameter diversity, or anisotrichosis. So I want to see basically a different hair diameter diversity of around 15 to 30%, meaning to say, I see hair that can be helped by the procedure. Now, what is the procedure itself? It's actually quite simple. All of us board-certified dermatologists have, from residency training, been doing punch biopsies using a small little instrument of different sizes. In this particular case, our little scalpel is just 2.5 millimeters, from which I would take 3 samples from the back of the head on the occipital area. And I do this because it can be easily covered by hair, and because the hair around this area is resistant, is normally more robust, more resistant to hormonal changes such as dihydroxytestosterone. So here on the lower left side, you will see the procedure itself. We are just gently under local anesthesia, picking up 2.5 millimeter samples, and we put it in the sterile Regenera capsule, the Regenera Con. This is what's patented. This is a patented microdermatome, wherein there are 100 cells, there are 100 openings, each one about 80 millimeters in 80 microns in diameter, and through which it is spun around in a centrifuge, a special centrifuge, and what the viable cells fall out together with the niche, the microenvironment which the cells live. So we just don't isolate ourselves with the cell. We normally take the niche or the microenvironment, so that when we inject these into the affected areas of the scalp, we will not just be helping the patient by putting in the plant, but we put in also the soil around the plant, which it happily grew at the back. Now, what are the results? And this is what I think most patients would like to see. This is one young patient, a middle-aged patient, relatively young, because I'm old already. This is within 1 month, 1 session. This is another patient. And these are 2 other patients, all within 1 month. Generally speaking, I tell the patient during the consultation for the procedure, if the patient is already a good candidate without any medical problems, and the patient understands what the procedure does, I tell them we see you at 1 month, but the most number of hairs you will see, the greatest density will happen at 6 months. So generally there's hand holding, and I see the patients frequently, once a month, once every 2 months, just for them to be reassured that the procedure is taking effect. Now, this was from a recent study wherein, as you can see here, TO means to say before the procedure, and T4 was 4 weeks later. You can see the increase in number. And the bottom one was another patient, and that was at 6 weeks. But again, I would like to see the patient. I would like to reassess the patient at 6 months. I always tell the patient, yes, I'll see you in 1 month. And yes, we can see each other every month if you'd like. It's not a problem. But definitely, please be patient. The bulk of the treatment, the most that you will see will be at 6 months. And this, Dr. Romero will be happy to see histopathology slides. We can see the baseline before the treatment and after 6 months, wherein you can actually see hair roots, hair follicles, cuticles growing happily. Post-procedure, after the 30 or 45-minute procedure, all I have to do is tell the patient, just don't wet your scalp for at least 24 hours, 48 if you can manage it. And if you're uncomfortable already because your head feels para kang nabugbog, you can just take 1 Tylenol or Biogesic and avoid strenuous activities. And sun protection is really important. Although now it's pretty cloudy, it would still be a good idea to wear a cap just to make sure your scalp isn't accidentally burned. So this procedure is 30 to 45 minutes, and patients normally like it because it's only 1 outpatient procedure, and social downtime is very minimal. You don't need to hide. And thank you for your kind attention. These are my references. And I think Mr. Romero can go to the question and answer portion, which I think is the most important.
Thank you, Doc Sherry. You're right. We've been getting lots of questions from different sources. Let me start with a question that was sent to us even before the webinar began. And Dr. Jamora, I think it refers to telogen effluvio, just to prove to you that I was listening.
Wow. Good job, John.
So, this lady says, I'm
Go
having
ahead.
hair loss. It seems at least 300 strands a day. She gave birth last January and was at first thinking that childbirth could be the cause. But seeing her hair all over the house has increasingly become disturbing. How would she know whether the cause could be an underlying condition or something else? Does she need to see a specialist other than a dermatologist? So that's your question.
So Jazz, would you like to take that?
Okay.
And I'll chime in.
Yeah, I'll take it first, Cherry, and then you can add on to it. I believe, Jong, that this is a most likely telogen effluvium due to her delivery. Now, I believe it's quite rare to have chronic telogen effluvium, so she should start to see some regrowth in the next few months. Of course, it would be good for her, especially if her concern is great and she needs reassurance, to see a PDS board certified dermatologist so that she can get a workup just to make sure that we're not missing anything. So we could check her thyroid, we could check her ferritin, and check bio zinc levels, vitamin D3, hormones, and just make sure that everything is okay. Now, if everything is okay, then we can just wait. Sometimes we can give topical, but if she's breastfeeding, we won't give her anything. We'll just wait for it to come back. Now, sometimes we have to just reassure patients and tell them that your hair may not grow back as thick as it once was, because just by regular aging, like, I feel sorry, Cherry said she's old. We're all getting old together, Cherry. This is the good part about the aging. Sabay-sabay na tayo mag-age. But as we get older, our hair really will thin out, and it can be even distressing for me when I do a ponytail. I'm like, oh, my ponytail is not as thick as when it was when I was younger. So I believe that if she would like to come in for an assessment, that would be good, just to reassure her and tell her, what options there are. But we'll have to make sure that, she's not breastfeeding and all that. Cher, you want to add something to that, Cher?
Yeah, Jazz, you're right. So normally this is a medical problem. It would be great if she could find time to see one of the board certified dermatologists, and they would do baseline studies apart from what Jazz mentioned, thyroid, vitamin D3, zinc levels. We would also ask for the basic CBC with the iron studies, TIBC, serum ferritin. Yeah, basically that's it. And then we would see where the problem lies. Now, hand holding is really important. Whenever a patient comes in with hair problems, I never want to add to their problems already. So I always tell them, thank God it doesn't seem to be cancer. Thank God it's not COVID. Yeah, so it's a minor thing that we can deal with. We just take it one step at a time. So it would be best for this patient to see a board certified dermatologist from the PDS nearest her at her convenience. And then we'll take it one step at a time to work up to rule out any kind of medical problem, do a history NP to check if she's taking some supplements or doing something to her hair that might have aggravated it. And we'll find out if her husband is aggravating it by not helping taking care of the kids. So that's another stressful situation. Or kung walang yaya, I remembered Juliana, when she was born, and my yaya disappeared, for a month. My short hair started falling out in clumps. And my late husband, Clayton, said, ano ka, magiging kang kalbo, kagaya ko? Then I said, no, I'm dermatologist. I just gotta calm down. Think positive, calm down. So,
I
yes,
love it, Cher.
I sympathize with that patient talaga. So
Yeah.
not to worry, please see your board
Yeah.
certified dermatologist soon and we can help you.
Thank you.
Definitely.
Thank you both. So we touched on the subject of age, and of course, there's a question about that. Somebody sent in a question asking, this person would like to ask what causes hair loss for people between their 20s and 30s. I guess some of this was, or a lot of this was covered earlier. In this person's experience, he or she has been losing hair since he or she has been in college. So this person asks,
Sounds like my husband, my late husband, has been losing hair, according to him, since he was first year high school.
oh, okay.
So
I
in
was
answer to the patient,
Yeah.
and
side.
Jas will probably tell you also something similar. You have to look at the family history. So if this person unfortunately has pattern hair loss in both the
Yes.
mom and dad's side, it's
Definitely.
not their fault. That's what
Yeah.
I tell my poor daughter, Juliana. Juliana, this is not your father's fault. He just inherited you. So not to worry, we can take a look at it. And I hope that patient, if he or she is in her late 20s, 30s, I hope they don't have any bad habits as well, like smoking, drinking, or in a highly stressful occupation, which could contribute to the experience of this patient. Jas?
Yeah, absolutely, Jong. It sounds like androgenetic alopecia, but he needs to be seen. Check the pattern of hair loss. Just make sure that it's nothing else. As Cherry said, we'll just thank our parents for our good looks and our good brains, no. But if you're losing your hair, genetics plays a large part. As Cherry said, try not to smoke. Don't get stressed. Don't be exposed to too much pollution. There's a lot of factors that are causing pattern hair loss, and more nowadays they're finding out that a lot of microinflammation is triggering it. So they're
Yes.
working on it with some supplements. They're definitely studying it, and of course, Dr. Cherry already talked about the stem cell and growth factor options for that. So it's being studied more and more. John?
Yeah, we'll get to Regener in a bit, but Doc Hamara, you mentioned microinflammation. So um, you said there's some supplements and all that. How important is diet in keeping your hair, I suppose?
Yeah, diet will play a very big part because often nowadays with a lot of fad diets, okay, especially keto, a lot
Yeah.
of people are doing extreme forms of intermittent fasting or they're really cutting out large parts of their diet, no? We have to be careful because we might be getting nutritionally deficient in something. So we have to make sure that we're eating a lot of fruits and vegetables, with different colors, so that we get a lot of antioxidants, minerals, and supplements. There may be, John, you're asking about supplements. A lot of the supplements on the market are not really well studied. So you can find in the studies, like in the Journal of Drugs and Dermatology, they have been starting to do randomized control trials with things like micronized collagen with saw palmetto. I mean, these are things that are available in the States. And I think more and more we're going to see that some of these supplements are effective. But you know how some people love to take biotin? Like, biotin is like
Yeah.
such a, like, it's so uso, right? They're like, oh, my hair's falling, let's take biotin. But unless we have documented biotin deficiency, I would not recommend people to take these supplements on their own because it needs to be taken in a proper dose. It needs to be taken in the proper way before we just take these supplements. Yeah, Cherry, you want to add something about supplements and diet?
Yes, thank you. Yes, thank you, Jazz. You mentioned vitamin B. So among the vitamin B family, we are looking at B2, riboflavin, B7, biotin, like what you mentioned, folate, and cobalamin. Now, I don't recommend randomly taking supplements unless you have a proven deficiency for it. Now, vitamin E, for example, vitamin E is associated, a deficiency is associated with seborrheic dermatitis, but I still don't want to suggest taking vitamin E on your own unless we see that the seborrheic dermatitis cannot be helped by topical medications and a change in hair care regimen. There are many other micro supplements. There are minerals such as zinc. Bottom line is, please don't take this randomly unless there's a proven deficiency. Otherwise, as what Jasmine said, just be sure to eat a balanced diet and lot of greens. And that's basically it. So don't take anything unless you're sure that's what you need. That's what's lacking in your body, in your hair.
Okay. So you got a little garbled there, Doc Cherry, but I suppose what you're saying is do not self-diagnose and make sure what you're taking is a medically diagnosed condition and medically.
Yes. Thank you.
Got it. Several questions about dandruff. Why does it happen? How do you avoid? The flaking is annoying. The itching is annoying. What can they do?
Let me start off, Cherry. Okay, so
Yeah.
we know that dandruff or seborrheic dermatitis is also genetic, most likely. Okay, so a little bit of flaking on the scalp is dandruff. When it gets a little bit more severe, where we have redness of the scalp, itching, flaking, scaling, seborrheic dermatitis is the proper term for it. It can also affect our face, in between the eyebrows, on the sides of the nose, on the chest and back. And it is genetic. It can be seasonal, especially if well, now we're not traveling anymore, but in the past when we traveled and there was a change in weather, it would flare, or if it was like from hot to cold or cold to hot season, it would flare. When we have a lot of psychological stress, seborrheic dermatitis can flare. And I saw Dr. Arnie mention COVID. Yeah, COVID stress, right? A lot of people are really stressed with the COVID. So a lot of flaking, a lot of seborrheic dermatitis. So there are many over-the-counter shampoos. And full disclosure, we have no interest, neither Chair or I have any interest in the products that we're talking about today. So there's a lot of products on the market that have zinc pyrithione, that have ketoconazole, that have selenium sulfide that can work, even things with coal tar and salicylic acid. But they need to be used properly, Jong. So these dandruff shampoos need to be put on the scalp for about 5-10 minutes, leave it there, and then wash it off. And that's the proper way to use these anti-dandruff shampoos. Now, whether you use it 2-3 times a week or more frequently, it can be a big help. And if it's not working, then I suggest you go see your PDS board certified dermatologist for additional help. Cherry, you want to make a comment on dandruff and scaling?
Basically, when the problem is active or new, it's ideal that you use it on a daily basis for about 2 weeks and then gradually taper it off. Seborrheic dermatitis dandruff really does come back, especially when the patient is under a lot of stress, and stress could mean the environment, whether it's work related or emotionally related, or because you have a medical problem. So basically that's it. So definitely over the counter anti-dandruff shampoos do have a place and can help as long as you properly use it, like what Dr. Jasmin said.
Thank you. So now I'll move to the Regenera questions, but they seem to be general dermatology questions as well. The common questions, the common questions are: is Regenera for everyone, and what's the minimum age for Regenera? Like, can a kid of 10 years old go for Regenera, and how long does it last? If so, Doctor.
Okay. As a general rule, I don't like to do teenagers, but if the parent comes along and is insistent on it for whatever reason and gives his or her own approval, yes, I will try to attempt it, assuming that the patient is a good candidate for it, meaning to say there are no other factors that have contributed to the hair loss. And I have to be absolutely sure that this patient is a case of androgenetic alopecia. With regard to the other part of your question, which is how long do the effects last? The longest follow-up study was 3 years because this is a relatively new technology. It's been on the market, approved in several countries for about 6, 7 years. The follow-up has been, published literature has been 3 years. Now, how many times do we do this? We normally just do this once, just one time. Although I do have a recent patient that wanted to do it again, even though it's not been 6 months. And that patient, I would have to say, because of her close friendships, I did not, I was not my usual strict self, Jas. I wasn't my usual strict self asking for all the labs and everything. And I took her word for it, and she had this sense of urgency because there was an important event in her life coming. And so I did the procedure telling her, please get these tests done. So when she did follow up, there was hair, but not the way that I expected it, although we are not at the 6-month mark. And when she did give me her labs because of the pandemic, lockdown and all that, this was 4 months after the procedure, what I found out was that she had subclinical hypothyroidism. So I did explain to her that unless we correct this problem, doing a second session will not be of help. Now, her hair that's growing is good, that's good for her, but if we correct the endocrine problem, the response to the one treatment would even be better.
Got it. Thank you. Question here is, I would like to ask, not me, but this guy or girl, if you still use minoxidil or oral finasteride after treatment with Regeneron or AMP. And if yes,
Yes.
at what point post-treatment do you start or resume this regimen?
Normally I would tell the patient, it's okay to do it, to continue with it, although eventually you can discontinue that. So I don't like to waste money. It's my Ilocano nature. And so I'll tell the patient, just continue using it until you're done. It's fine. It won't do you any harm. But eventually you're not going to need it. That's why we have Regenera. It's a procedure much like Jas, our laser procedures. When we do laser procedures, Jas and I, we normally tell the patient, you won't basically need all the other stuff that you're applying on your face, except for your skin cleanser and moisturizer. Those are the basic items, because you're paying for something that would speed up the improvement. Any more questions?
So back to AGA, androgenic alopecia. A question here is, what can you say about taking tocopherol, Tocovir 100 mg in AGA? They claim they have studies to prove its effectiveness. I guess for laymen like me, what is tocopherol and what does it do? And then does it work?
Yeah, that's vitamin E,
E.
Jong. So I haven't actually come across any studies right now. I would be wary about taking vitamin E for many patients. It tends to cause a lot of blood thinning, and you can't undergo procedures if you're on vitamin E. So just be careful and make sure that you have a doctor giving you the vitamin E. And with regards to hair studies, in all my readings for this talk, we did not come across vitamin E as a good supplement for androgenetic alopecia. As we said, we talked about topical minoxidil and oral finasteride. Please go see your PDS board certified dermatologist to get a prescription and more information and a workup about androgenetic alopecia. Thank you. Chair, you want to say something?
Vitamin E is not water soluble. If you take it in mega doses like vitamin C, for example, you can just pee it away. but vitamin E is stored, and so that could cause problems eventually, major problems. So it's not a good idea to take vitamin E randomly for a hair problem unless we are absolutely sure what the hair problem is in the first place. And that's it.
Yes, thank you. So, let me just go through the other questions. We have a question from, I think, an expat. This person has just moved from India, and this person finds that his or her scalp has been flaking and hair has been falling a lot. Question is, can this be because of the water? And I guess the underlying question is, um, can a change of geography be the cause for hair loss? And are there supplements or ito marami, a lot of questions on particular shampoos. Uh, do they work? Those that claim to thicken the hair or make the hair grow, and are there other supplements that we be aware of? So we're a lot of
Okay.
revolving in that area.
I sympathize with this lady because it's difficult to move. So first of all, the move is very hard and psychologically it's very stressful. So I wouldn't be surprised if that's adding to her both the flaking or the seborrheic dermatitis and possibly hair loss. Now, there was another question about hair loss, 2 to 3 strands. Remember, I mentioned that anywhere from 50 to 150 hairs falling out per day is acceptable. So what you would like to do is don't shampoo your hair for a day and then count the number of hairs that fall out on that day in your pillow, on the bathroom, and if it does not exceed 150, then don't worry about it. That's just normal hair fall, okay? Because I saw another. So a second thing is the hair growing shampoos, Jong. So remember that shampoos, we will kind of wash them off immediately. So unless you're using it like the anti-dandruff shampoos, leaving it on 5, 10, 15 minutes, it's not going to really absorb and affect your scalp. So how will it reach down into the hair follicle and make your hair grow? So we can't expect the shampoo to kind of grow the hair. So I wouldn't rely on that for now. And John, was there another question for her? I believe she would probably should see somebody just to make sure that if her hair fall is ongoing, just to make sure that nothing else is happening, and just to get a general checkup. Chair, do you want to add to this?
Yes, I had a similar case last year wherein the person moved, and the question that she asked me was if the water had anything to do with it. Then I said to her, well, as far as I know, if you're using hard water to wash your hair, what basically happens is that the hair becomes thinner and it easily snaps. That's basically it. Apart from that, hard water, and I think the water here in Manila isn't hard ba siya, Jas? I'm not so sure. I started drinking ever since Juliana was
I
born.
don't
I
I
started
don't think
buying water
so.
in the purified
Yeah,
water.
I think it's more on in the province where you have kind
Yeah, with the
of
well,
that
no, the
hard water,
wells.
but or more mineralized water. Yeah, but I haven't really seen an effect of the water on hair loss, but I'm not sure. We have some PDS dermatologists on the watching as well, so they might know if you could add it to the chat. But personally, I don't think the water would have much of.
And so that patient invested in deionized water to help with her hair because her friend said that would be great. So I said, sure, you can, no harm done, but I would like to do blood tests on you. And so she agreed. And then we found out she had an underlying anemia, and correcting that anemia
Okay,
helped her along the line.
okay, that's excellent.
Great.
Okay.
We have a minute left, so we'll probably go over a bit. I hope that's okay. A lot of the questions kind of spill over into the skin area, so that's probably our cue to organize another one for skin disorders this time. So we'll have another discussion offline about that.
Sure,
um, but
sure.
maybe um, maybe now is a good time to ask both of you individually for, I guess, final words or words of wisdom that we can we can hang on to as this lockdown, as this pandemic continues. Um, what we can do to hang on to our hair or make it even grow better.
Jazz, would you like to
Yeah,
start?
I think friends, yeah, I think we have to keep our mindset. We have to protect our health, no? And it is really a holistic thing. So I believe that all the dermatologists at CMI are interested in holistic care of the patient and holistic dermatology. And we have to think of both body, soul, and spirit. So for our body, eat well, make sure you're sleeping 7 to 8 hours a day, make sure you're exercising 30 minutes at least 3 times a week, getting in a lot of aerobic exercise, get some fresh air, vitamin D every day. Don't smoke and drink alcohol too much. Don't order delivery too much. Make sure you're eating a lot of vegetables and eat one serving of fruit a day. And most of all, pray. Trust in the Lord that this will be over soon. He is a good and gracious God, and I believe that that He will see us through this. Okay, Chair.
I agree with you, Jazz. It's always God. And I want to tell my patients that thank God you don't have COVID, that it's just that. And we're here to help you. You can contact us by telephones, teleconsultation if you're scared of coming face to face. And I think Mr. Romero and the CMI family can easily help you with that.
Definitely. So thank you very much. We didn't get to cover all the questions we were sent, but to our audience, please be assured that we will be getting back to you through email now, and we'll continue to talk to Doc Cherry and Doc Hasmin about these questions. So if you want, for our audience, for those who attend this webinar, if you want to reach out to our dermatologists, all our dermatologists are both like Dr. Blas and Dr. Mar are with the Philippine Dermatological Society. We'll be flashing our contact details right now. So we're open Tuesdays to Saturdays from 8 a.m. to 4 p.m. And you can call us or text us or Viber us through our mobile number, 0927-931-794. And or email us through experience at cminternational.com. Um, and also, Dr. Asmin says, you may find PDS dermatologist at pds.org.ph. And before I let you go, I'd like to invite you to our next webinar, which is scheduled for August 1st. So now we shift gears a bit and we talk about our adolescents or our not so young teenagers anymore. The webinar will be about addressing the impact of the pandemic on adolescent behavior. It's on August 1st from 2 p.m. to 3 p.m. That's a Saturday. And our speaker will be Dr. Ruby Punong Bayan. And on that note, ladies and gentlemen, thank you once again for joining us for this webinar. It's always a pleasure for us here in CMI to provide you with relevant information and useful tips from our very, very experienced and high caliber doctors. Dr. Jamora, Dr. Blas, thank you very much for your time. And good afternoon, everyone. Thank you.